Welcome back YouTubers to my channel of an everyday life of an Aspie. Welcome to the newbies also. I'm Aspie. I'm all about creating mental health and awareness versus sharing my life stories with Asperger's syndrome, OCD and the like to hopefully take you on a journey of what my life is all about. I also do some tips and tricks along the way of managing and treating some everyday, struggles that you go through, regardless if it's your personal health or just stuff in general that you'll go through, be it whatever it may be. Here's an example for coming from a broken home or anything like that, just to give you guys support and encouragement and words of light based on my experiences, and hopefully some of that will come into feature. It has been brought to my attention, despite that I'm trying to do some research on the touchy subject that I'm hoping to address either next week or the week after, as I see for 3 weeks time, that it's going to be some of it touchy, but it needs to be addressed anyway based on what I understand and everything else, because some of it hasn't been discussed much lately of some of this, and it still exists today of what the problem that goes on. But in the meantime, I'm going to try and bring out as much mental health and awareness series versus just every other topics that comes onto my channel, because obviously I'm all about health and awareness versus sharing my life stories and whatever else, and hopefully, like I said, jazz it up with a bit of fun and games and everything that you have seen currently on my channel. Even though I'm hoping to branch out my channel a bit more maybe later on of whatever is entailed. So this one's going to be put into 2 parts, obviously, hopefully, depending on the time I've got with you today. This one's is going to be all about stroke, what you need to know. I felt in my heart to share this because obviously it's like a chronic illness, and we need to be aware obviously of some of these chronic illnesses because they do exist, like many other mental health issues that people will say it doesn't exist, it's all in our heads and whatever else. You won't know until obviously you experience it yourself, or you find someone that you love and care about that is experiencing these chronic illnesses or just mental health issues or whatever it may be, so that hopefully we can learn and educate from each other, whatever it may be. So let's begin this before I run out of time. So this is part 1 obviously of the all about stroke. Give me the delightful thumbs up so far if you're liking these, just hoping that you are, or even just by commenting below will be nice, so I can have a bit of feedback here and there. So let's begin this. The question that many people will be running through their minds, as always, like any questions, is what is a stroke? Okay, stroke occurs due to problems with the blood supply to the brain. Either the blood supply is blocked or a blood vessel within the brain ruptures, causing the brain tissue to die. Before I continue, there's a diagram right now above you that is showing the different parts of the brain where the stroke can attack on a person. Medical emergency and treatment must be sought as quickly as possible. A stroke is known as an attack of the brain or the brain attack. It can happen to anyone at any given moment of time, young or old. It occurs when blood flow to an area of the brain is cut off. When this happens, brain cells are deprived of oxygen and slowly begins to die. When brain cells die during a stroke, abilities controlled by that area of the brain, such as memory and muscle control, are lost. But then again, it will vary from person to person where the stroke has been attacked on the side of the brain and whatnot. So this breaks down to how a person is affected by the stroke, as I said, depends on where the stroke occurs in the brain and how much the brain is damaged. For example, someone who had a small stroke may only have minor problems such as temporary weakness of an arm or leg. People who have larger strokes may be permanently paralyzed on one side of the body or lose the ability to speak. Some people recover completely from strokes, but more than 2/3 of the survivors will likely to have some type of disability after this. So there are 3 main kinds of strokes, and they are, and I'm going to break it down to you, as well as also just briefly discussing what the causes or how it affects people. So number 1 is your Okay, before I continue, here is another diagram between the types of strokes, one of which is the ischemic and the hemorrhagic stroke, to clearly illustrate to you all what it looks like, along with the description that is coming up next. Ischemic strokes, which is obviously a blood vessel carrying blood to the brain, is blocked by a blood clot, hence the word ischemic, or I think it's pronounced as that, is one type of stroke. This type of stroke is caused by blockages or narrowing of the arteries that provide blood to the brain, resulting in ischemia, severely reduced blood flow. These blockages are often caused by blood clots. which can form either in the arteries connecting to the brain or in the other blood vessels before being swept through the bloodstream and into narrower arteries within the brain. Clots can be caused by fatty deposits within the arteries called plaques. Next one of the three stroke types is your hemorrhagic strokes, which obviously is like a brain aneurysm that bursts or weakens the blood vessel leak, hence the word hemorrhagic, is one of the two types of strokes. While the least common of the two types of stroke, it most often results in death. Hemorrhagic stroke are caused by arteries in the brain either leaking blood or bursting open. The leaked blood puts pressure on the brain cells and damages them. Blood vessels can burst or spill blood in the middle of the brain or near the surface of the brain, sending into the space between the brain and the skull. The ruptures can be caused by conditions such as hypertension, trauma, blood thinning, medications, and aneurysms, weakness in blood vessel walls of what an aneurysm is. Intracerebral hemorrhage is the most common type of hemorrhagic stroke and occurs when brain tissue is flooded with blood after an artery in the brain bursts. Subarachnoid hemorrhage is the second type of hemorrhagic stroke and is less common. In this type of stroke, bleeding occurs in the subarachnoid space, the area between the brain and the thin tissues that is covering it. And before I continue, just a heads up, I'll have some diagrams showing some of the different types of strokes and everything else here so that we can follow on and hopefully it'll give you guys a clearer understanding. So, last but not least of the three types is your transient ischemic attacks, or TIAs as they call them for short. These are usually referred to as mini strokes. TIAs are different from the aforementioned kinds of strokes because the flow of blood to the brain is only briefly interrupted. TIAs are similar to ischemic strokes in that they are often caused by blood clots or other debris. TIAs should be regarded as medical emergencies, just like any other kinds of stroke that may encounter, even if the blockage of the artery is just temporary. They serve as warning signs for future strokes and indicate that there is partially a blocked artery or clot source in the heart. Some fast facts on stroke. Here's some key points about strokes. During a stroke, the brain doesn't receive enough oxygen or nutrients, causing brain cells to die. There are three main kinds of stroke, as I mentioned: ischemic, hemorrhagic, and transient ischemic attacks. Ischemic strokes are caused by a narrowing or blocking of arteries to the brain. Hemorrhagic strokes are caused by blood vessels in and around the brain causing bursting or leaking of the brain. Strokes need to be diagnosed and treated as quickly as possible in order to minimize any further brain damage. Remember the FAS acronyms that can help recognize the onset of the stroke, which obviously is face, arms, speed, time. Obviously, treatment depends on the type of stroke. Ischemic stroke can be treated with clot busting drugs. Hemorrhagic strokes can be treated with surgery to repair all blood vessel weaknesses, or block blood vessel weaknesses, I should say, humbles. The most effective way to prevent strokes is through maintaining a healthy lifestyle from early to later age. The symptoms of stroke. Obviously, it's when those strokes occur really quickly and without warning sometimes, and as such, symptoms of stroke often appear suddenly without the warning, hence why I'm bringing out the signs and symptoms, so that if you do see them first, seek professional help for yourself or your loved one. The main symptoms of strokes are as follows: confusion, which would be including trouble speaking and understanding what is being said or heard about; headaches, possibly with the altered consciousness or vomiting; numbness of the face, arm or leg, particularly on one side of the body, however; trouble with seeing in one or both eyes; trouble with walking, including dizziness and lack of coordination. Strokes can also lead to long-term problems depending on how quickly it is diagnosed and treated. However, the patient can experience temporary or permanent disabilities in the aftermath of the stroke, hence what I mentioned before. In addition to the persistence of the problems listed above, patients may also experience the following: bladder or bowel control problems, depression, pain in the hands and feet that gets worse with movement and temperature changes, paralysis or weakness on one or both sides of the body, trouble controlling or expressing the emotions. How to diagnose a stroke. As I said before, strokes happen fast, will often occur before an individual can be seen by a doctor for a proper diagnosis. The acronym FAST, as I mentioned before, is a way to remember the signs of stroke and can help identify the onset of stroke more quickly. So obviously F is all about your face drooping. If the person tries to smile, does one side of the face droop? Arm weakness. If the person tries to raise both arms, does one arm drift downward? Is a question to ask yourself. Speech difficulty. If the person tries to repeat a simple phrase, is their speech slurred or strange? Time to call 111. If any of these signs are observed as above, contact the emergency services quick, smart. In order for a stroke patient to get the best diagnosis and treatment possible, they will need to be treated at a hospital within 3 hours of their symptoms first appearing. Both ischemic strokes and hemorrhagic strokes require different kinds of treatment. Unfortunately, it is only to be sure of what type of stroke someone has had by giving them a brain scan in a hospital environment. Well, this quickly ends the first part of the introduction to all about stroke, what you need to know. Give me a like for a thumbs up for support, comment below. Feel free to follow me on my social media sites, that is linked below. Feel free to subscribe to my channel if you haven't done so already, because I hopefully do this on a daily, weekly, depending on my schedule as always. Feel free to also turn on the notification bar so that you know what's going on with me regardless of the topics. Feel free to share these videos around to family and friends, because as I said, some of these needs to be shared around regardless of the health and awareness. This is just normal everyday situations that we face as form of motivation, encouragement and whatnot. So don't forget, guys, thanks for support, thanks for watching. Do what you love what you do. Until next time, Aspie signing out, and I'll see you all again soon. Ciao for now.